Good morning. We have seen about the detail about the experimental research design. So always the experimental is not possible in a clinical setup, but experimental is a very good research. So some areas we cannot go for experimental research, we go for the quasi experimental research design. However, this research is also have an intervention like a experimental research design, but there is a lack of randomization. To control and the treatment group, there is no randomization will be there. Okay, why, how this study emerge? You ask yourself, is there your study have an intervention? Yes, I am doing an intervention. I am giving amla date honey to the child. Okay, do you have control over the intervention? Yes, I have control over intervention. How you have control over intervention? Because I have taken one control group and experimental group. So I have control over intervention. Yes, you have taken it. Okay, if no, it is going to the non-experimental research design. Yes, is there random assignment is there in the treatment group? Yes, I have a control group. I have a randomization also. I have a intervention also, right? What is that intervention? Amla date honey I am giving for anemic child. Okay, is there intervention? Yes, intervention, control over the intervention. Yes. So I have a control group and randomization also. Yes, all MCR is yes, then it is called the experimental research design. No. I have a control group, but no random assignment. No, how you are telling random assignment? Yes, I select one school as a control group, but it is injustice for me to select anemic girls and half of the anemic girls giving amla and other girls will be looking without giving. It is ethically wrong. So I not randomized the children who are anemic. I have selected all children who are anemic. So there is no randomization for me in my study. There is no. Okay. Is there any effort to compensate for the lack of randomization? Yes, I have make an effort to compensate on the lack of randomization. To not to done the randomization, I have taken a control group with the same standard, same I'm matching criteria and anemia, females, I have taken a same thing I have done to control the extraneous variables. Correct? Yes, I have done it. Okay, then you are the quasi experimental research design. No, I not do any randomization. Just I do some intervention. Only pre-test post-test. It's called the pre-experimental research design. Understand? So this is how the quasi experimental research design is coming. So though my study amla dates honey, how it is going to be effective for anemia, though I have done a lot of money, put an intervention I have done, it is not a experimental research because there is a lack of randomization. To overcome the lack of randomization, I go for the control group. So it is called the quasi experimental research design. Like in experimental research design, as we have seen, there are many different kind of a quasi experimental research designs are available. Let us see what is that. Okay, rather seeing one with we will see and with the implementation. I have taken this quasi experimental research one problem statement. I want to assess effectiveness of MTP. What is MTP? Not a medical termination of pregnancy. It is the effectiveness of motivational training program among the employees of selected hospital to prevent the employee retention. Understand? The employer only will be knowing what is the pain if the such a like interview, selecting money and so much money intervene and giving them training program, and the employee will leave the organization within 2 months, 3 months. It is really bad for the employer. So big hospital they can do this study. So what are you going to do? This is the problem statement. I want to see the effectiveness of MTP among the employees retention. I am going to do. Okay, we have the many studies are there. What is there? Non-equivalent control group design. I am going to take non-equivalent control group design. I am going to take 2 hospitals. What is intervention? Intervention is MTP. What is in MTP? Motivational training program. So non-equivalent control group design. This hospital 1 X, hospital 2 I have taken. It is not an equivalent hospital. Either I can take private, means private hospital, different hospital, not coming under the same employer or something. So I go to the 2 hospital, but 1 hospital I am taking as an experimental group. Another hospital is a like a control group. So I go to the Apollo hospital is my experimental hospital. Max Hospital Delhi will be my control group, you imagine. So Apollo hospital, I go to the employees. Employees may be like a staff nurses who is coming to the Apollo. Understand? So pre-test I am doing for, I may do inclusive, exclusive criteria, who am I going to. So within the staff joined within 6 months, I am going to take it for that, right? So I will ask them what are they there, and then I will call all the induction and training, and MTP I will implement, motivational and training program, which consists of like you work here, if you work in Apollo you can work in abroad, and we provide you certificate, 1 year you will provide you incentives and promo, something I am going to give, like some training programs I am going to in service education we give you an opportunity so you can develop. We have some of the post diploma courses in Apollo, you have work and study, like that some motivational training program I'm giving to the new nurses, who novice nurses who has joined. Okay, then after 6 month duration I am assessing. Observation 2, whether how many nurses been resigned and gone. This is in Apollo hospital. You take it as a Max hospital. I go to the Max hospital, same criteria, inclusive criteria, new novice nurses who join for the duty, observe them. Then after 6 months, I go them, same nurses are there or not. Okay, then I will compare and contrast how the MTP was effective. So how it is important to give the motivational induction training program for the arrange for the employees by the employer is very, very important. Understand? This is a non-equivalent control group design. Okay, non-equivalent control group post-test only design. Post-test design, you take like it Max Hospital and Apollo Hospital or Max Hospital, 2 hospitals. 1 hospital I not do any pre-test. I go directly Apollo hospitals and giving them MTP. MTP I am giving, applying and then assess their post-test. And another hospital doing only post-test. Within 6 months how many people resigned and went. So I will see how the intervention is. Okay. Then also something wrong. No. Whether this MTP was more effective, because I am not assigning randomly. So this is called the time series design. So in the month of January, I go observe how many people resigned, how many from the job within past this one. And another 3 months again I am collecting data, how many people has resigned, statistics. And another 3 month gap, how many resigned. Then another 3 month gap, observation 1, 2, 3, 4. Then I give them MTP, motivation training. Then will be observation 5, 3 months and 6 months. So time series. So we do the analysis. What is the intervention? We do the post test. How many? So this shows is the reduction. We will do the statistical analysis. Okay, multiple interventions of the treatment. What is the multiple intervention of the treatment? Observation, it is one time only we have done and only this one. But here the reinforcement, same motivational training program, same nurses you will call them. Again you will do the same group, multiple time, point of time. 3 months once, every time you come, 1 month you observe it and another month you observe they not resign, and 4th month you give them intervention training program. 5th, 6th month just observe them, how do they feel, collect it, they resign or not, what is the, how do they feel, job satisfaction, everything, or burnout or frustration, stress or anything there, measure it. And then again you give them motivational training, again measure it, again measure it, again measure it. Are they retained in your hospital? Check it. Okay, this the time series with the intervention. So intensive intervention. So you are not only giving MTP, you are also trying to give them some of the incentives, some of the other things like promotional activities, like you will be choosing them, and novice nurses you select them, best nurses award, something else. Not only this motivation, you do some other intensive interventions like incentives, a form of incentives or form of some reinforcement you give it to them, and you observe it. One time you give it to them, then one time only MTP you give. So which is more effective? Okay. Okay. Another one, time series with withdraw or re-intensify treatment. Observe them, how many people retained and went, how many people, like how they are there, and do the MTP and observe to them. And another one, another 2 months of multiple point of time, you withdraw. Don't do, withdraw it. And then you re-intervene afterwards. So this it will take nearly 1 year. So this period within 3 month, 3 month, 3 month, 3 month gap, and which period point of time they have left the job, you can understand. So this is called the time series design. Three kind of a designs are there. Okay, non-equivalent control group design, non-equivalent control group design, non-equivalent control group pretest post test only design, and the time series design. Time series design or multiple point of time, and then intensify treatment and withdraw. So you will see, when I give treatment, the employee retention, like resignation was very less, and when I do, it is more. Like that you can tell. Understand? So it is not the thing which research is good and which research is bad. It is not the thing. It is all the researches are good, but every time we cannot only experimental research good, not like that. Experimental research all the time it is impossible, so we are going same way. Sometimes experimental, for you take a total population, like the research is very very important. You know very well how many researches were going on during the corona time. Who has done those researches? Epidemiologist. So some of the researchers are coming under the non-experimental research design, also including epidemiological studies. So the epidemiologists are the number one people. They are the one doing a lot of studies. Understand? So they do experimental, analytical research, descriptive research, and everything. Let us see what are all the epidemiological study. How this is important in our research designs. So first is a descriptive research design. Descriptive research design is classified into individual research design and population. So individual will be maybe case study, case report, case series for the individual person. But about the population study, you know very well, you have Himalayan belt. Epidemiologists found out that the belt Himalayan area people are mainly affected with the goiter. Why? Because they have done that the ecology of the Himalaya, the salt in the natural soil, there's a lack of iodine. They found out that, then intervene. So this is a total population they have done it, right or not? Then will be univariate descriptive study, prevalence, incidence, relative risk. Yes, this we will see later on. And then we will see the analytical research. What is called analytical research? This is observational studies and interventional studies. What is observational studies? Observational studies are two kind of a studies: case control study and cohort study. So case control study is cohort. Case control is the retrospective study. Cohort is the prospective studies. So the cohort is also can be prospective studies and also retrospective studies. So it is a cohort is a forward looking studies. So it is very costly, it is less costly. We will see what these designs are telling. Understand? Interventional studies are called the clinical trials. Clinical trials are RCT. RCT is a very higher level of the research also. Mainly they follow the double blind method, triple blind method, clinical trials, drug trials done by the big people to test some of the important drugs. So that is called the analytical studies. Okay. Uh, In that, we have seen the univariate research design, the prevalent and incident studies. Why the prevalent incident studies? In 2019, 19 December, we all were looking at the television and laughing, hey, Wuhan virus is affected the China. Then 2019 December and January, some incident occur to the India. Are you understanding? This is a new cases. This is few cases come from flight and to the India. This is the total population. It's the prevalence. So this is a no case here, but a new case coming. When the new case is merged into the total population, these all are prevalent to get to the disease, and some will be died, some will be recover from the cases. So this we are doing a detailed study. Who is doing? Epidemiologist doing a detailed study. It is called the prevalence and incidence studies. Okay, madam, where do they get the data? Where do they get the data? You know, various data. There are varied kind of data they collected, like first beginning snowball method. Hey, who came from China or who came from America? And who is the relative? Where and all he visit? Snowball sampling technique. They counted how many people collected the data. And also, when it became a pandemic, many people started to die. So how they collected the data? They collected the data from death certificate, birth certificate, medical examination, hospital questionnaires, disease register, laboratory test, biomarkers, where and all they have done. Even you are doing a COVID test, that account will go to the government. Understand? Okay. So what is incident disease? Incident of the disease. How this new cases over the period of time and the population at the risk. You will die. And then expressing prevalence, present case plus new case is the prevalence. Present case and all the new case also include is the prevalence. Okay, understand? What is epidemiology? Epidemiology. Epi, upon, demo, people, logy is a study, studying upon a people. Epidemiology is a study of disease in a particular population. Okay, disease or disease event in a particular population. You are taking a particular population, you are studying that particular population, what's happening, how the disease comes. This study will reflect the total population, is called epidemiology. Epidemiology, study upon the people, a study of distribution and determinants of the health related events in a particular population, and this application of the result into the total population to control the disease in the country or the community is called the epidemiology. So these studies are playing a vitally important role in a community research designs. Epidemiological studies, incident studies. Yes. Next we will see about the level of evidence, the higher studies. If you see the research, how these research are in this one, which research is highly valuable. First is the expert opinion or the consensus of the statements, and the case report and case series or in the base, which is the higher value. These are all done. Case control studies, cohort studies, uncontrolled trial, randomized controlled trial, narrative analysis, systematic review, fine is the meta-analysis. Clear? So this is about the level of the evidence from this high efficient level, highly qualified, high level of the research. Understand? For example, here I have seen as a schematic represent. This is of individual patient data. Another level is the meta-analysis. Individual patient data you collect, do this, and the meta-analysis, and then systematic review and all review or narrative systematic reviews. Okay, let us see first the case control studies. What is called case control study? Case control design, it is the establishing the strength and association between the disease and the suspected risk factor. So case control study, it is the backward looking study. So you imagine this case control study, a hospital X and hospital Y. Apollo Hospital, Samlane Medical Hospital. Apollo Hospital or the Samlane Medical Hospital. Samlane Medical Hospital ICU. Many cases are there for the bed sore. So you take one hospital or compare the hospital in a private or the compare with or anything. Okay, or any two hospital you take. Patient developed the bed sore or the cases. Right? or the long term, prolonged bedridden patients or cases. So this is a control group. It's an experimental group, control group. So risk factor is present. What is the risk factor? What is the risk factor? So prolonged bed people may, what are all the risk factor can be found? Maybe they have mental depression, you can see psychological, and physically you can find the bed sores and other things. So risk is present or risk is absent for the cases. And the control group, risk is present or the risk is absent or this, and you will compare and contrast. So from the present to the past. So already the cases here already developed the bed sores. The cases means already they are this one. Control group, they are there who are having or not, who are not developed. So these also long term, this also long term. Why? What is the care which is not to develop the bed sore? What is the reason they have developed the bed sore? So this is called the retrospective. It's a present to the past. So cases are there and looking into why they are not developed, because the protocol is mainly time changing the bed and changing and all these things they are doing, so they not developed. The risk factor was not present there. You will do it. So that is called this one. Next is the cohort studies. What is called cohort studies? Cohort is a design used to determine association between the suspended cause, exposure and risk developing the disease. It is the prospective, it's a forward looking study. How do you recruit? Recruitment, who is the risk to develop the particular disease. For example, cohort study I wanted to do. One time I was working in Apollo hospital. There was a patient came to working in a nuclear plant. He developed the cancer in the age of 47. So I was interviewing him, I was talking with him. He told, ma'am, everything is free for me, everything they are giving me free. Like that. I was thinking that why he developed his lifespan maybe until 70, 80 years, but he developed the cancer. So I think that because of the nuclear plant he is working, the exposure to the nuclear explosion causing him the disease. Right or not? So this I wanted to do the study to the nuclear plant. I want to go. Those who are appointed, recruit the people who is risk to develop. So who is the risk to develop the disease? The people who are working in the nuclear plant. So select the individual, divide them into two groups, exposed to risk and not exposed to the risk. So this outside may not the same cohort you develop by, what is cohort? With the same age group you develop the cohort which is exposed to the risk. What is the risk? Exposed to the plant where they are working directly dealing with the nuclear products. And not, one is they are working but they are not exposed. They are working in an office or something. Follow up for the period of over a time, 1 decade, 10 years you follow up how they develop or not. How are they develop the data? How will they develop? So every time you go to this nuclear plant to check their health history, did you develop asthma? What is the existing record? What is the biochemical test? What is your hemoglobin level biomarker? Risk management. What is that? These are all the data collection method. Bias. Sometimes selection bias, follow-up bias, measurement bias, confounding bias. These bias can be happen, but you can find out what is the relative risk to develop the cancer. Clear? Okay, look at this design. Apparently healthy people here. The cases are already developed the bed sore. Here apparently healthy people, currently they are healthy, but they may develop the cancer because they are working in the X-ray department or nuclear plant. They are exposed for over a period of time, 5 years, 6 years, 7 years, 1 decade. Here not exposed for the period of time. So check them whether how many of you developed the cancer, how many not developed the cancer, how many, compare and contrast the both the group. So it is so costly. You already developed record will be available in your case control study, but the cohort study is a forward looking study. You every time go and do the blood checkup and everything is going to be very costly, but the record you take and do it. So this is called the cohort study. Hope you understood about the cohort study. Okay, next we will see about the higher level of the research. You have seen the higher level when it is going now is case control study, case studies, case series. We are collecting the data, no? Even our nurses, we are collecting case studies, case series. Okay, case control studies, cohort studies, uncontrolled trial, RCT, and narrative analysis, systematic and meta-analysis. Correct? Randomized control trial, RCT is very important. This is a true experimental research design. Mainly, as I told you, double blind, triple blind method also they will be using. They do not know who is the participant who don't know who is the researcher, and nobody knows what is the intervention is going on. Such a way they are doing in a meant avoid the bias. Mainly they are doing the drug studies. So it's a high level study also. More than that, what is they are doing? Narrative and systematic and meta-analysis. See, in a MSc level, you are not going to do. You can do it, but PhD level will be more better because you should have develop the skill in writing, skill in a review of literature. So why these narrative reviews are more precise and more useful and high quality of study? Why we are dealing narrative, systematic, meta-analysis? Little difference only, but you should know what is what. You see, this is a traditional literature review. Define the topic. My topic usually I am telling that I say that a vegetarian or non-vegetarian diet or the consumption of the fruits and vegetables or the risk or for the breast cancer. Is there anything is there eating having effect of the breast cancer? So I want to know that. So there are many case control studies or many studies might have done the people who developed the breast cancer. Understand? So I will be developing, I formulate, define the topic. Already I defined the topic. This is my first step. I defined already topic. What did I define? The breast cancer, what is the risk? So many case control study, whomever developed the breast cancer, what is their lifestyle, how to do, what to do, many case control studies might have done about breast cancer. So I select I collect all the case control studies, many studies, maybe 16, 20, 18 studies I do. So I will be, second step is I defined the topic is the breast cancer risk. Okay, now I will search the research topic and related literature. I'll be searching and the be critical thinking and eliminate the research. You can Brisma diagram, Brisma flow diagram, you can use it, remove which is not suitable and find the logical structure in a study. So usually it will be written by the experts. So it is what it is doing, it comprehensive critical objective analysis of the current knowledge on the topic. So what happened? Case study, case control study about the breast cancer, most of the people done with a lot of cases. And I take 12, 13 case control study means it is more precise, right or not? And all the results I am going to analyze and think logically what they want to say about it. Then I narrate and write. That is my review. It's more strengthened because I am analyzing lot of high quality studies and writing my narrative. Okay, madam. What is that systematic review? A systematic review also, the extracts and interprets the data from the published studies on the topic, then analyze and describe, summarize, interpretation into the refined condition. For example, anemia. If I put anemia, 1 lakh, 2 lakh people study done about the anemia. Anemia is one of the important problem in the community. Anemia is the one of the root cause of all the problems in our body. So what is the formulate research question? What is this anemia is affecting whatever formulate? So develop the protocol. What is the protocol? Search strategy. What is the anemia means? How am I going to develop it? Who is either the causes of anemia or whatever this I am going to. Then search all relevant studies about the anemia and eliminate which is irrelevant and apply the selection criteria. Which study I will include and extract the data. What they are telling about the anemia. How the anemia is affecting. How many people are impact of anemia. How these anemia people are long term. Whatever that study. Anemia means 101 study will be there. Only what study will be there, how the school children affected by anemia, this many percent, or they like me, they have done an interventional study. So what is the protocol I am going to develop? So according to that, when I am doing this amla dates honey intervention, I done one systematic review I done by the Prisma. How I done? I selected who and all done an intervention. I not found exactly my intervention, but I found some of the intervention. They have given a beetroot juice, somebody given a drumstick leaf juice, like that. Only 7 to 8 studies I have got it. So I developed the protocol. I developed, oh, this study must have an intervention for the anemia. So from 1 lakh study, it may come to the 1,000 studies. Then 1,000 studies with some protocol, only vegetarian diet or something. So the search and apply the criteria, extract the data, synthesis the data, write and publish. I try to say that even a no need to take the chemical medications. So like many studies states that anemia can be cured by the natural food, like the like beetroot juice or green leaves, excessive taking or the fruits, amla. All these studies are heavily telling that an intervention is so nice, right or not? So that is called systematic review. What is that? Meta. There's a slight difference between the systematic review and meta-analysis. Here, the intervention I have taken, here meta-analysis is otherwise called the like a statistical significant study is called the meta-analysis. In the meta-analysis, a technique to synthesis the result of the multiple studies. For example, I do the anemia study, I put one result. The result, my result is the one sample of meta-analysis. Another people done anemia study result, that will be a second sample, 3 sample, 4th sample. So it is statistically analyze the combination of the results and establish the effect of the population. So this purpose is establish the statistically significance with the studies that they have the conflicting of the interest. This main aim of this study is analyzing already existing analysis. Analyzing the already existing analysis. So no need to go and give any intervention. Sit in your room, take all the data from whatever that, for example, job satisfaction, about the nurses. So you do 1 lakh studies will be coming, job satisfaction, analyze it, what is the criteria, set it. So then each job satisfaction, somebody done one study, the result will be the one sample study. So many studies result will be this key are telling. Then analyze that studies. How many studies are telling burnout, suicide, all these points are the dissatisfaction of the employee. So that we can analyze. That's a study. This highly valuable study. It is called the meta-analysis. Clear? Okay. Thank you.